So one of the things that I'm very grateful for is the fact that when I became mayor, I was able to participate in a program with Mayor Mike Bloomberg and Harvard University, and through that, we've been able to get on time when, especially when the crisis was happening, information directly from Johns Hopkins professionals as well as Harvard University and Johns Hopkins University, giving us information on the medical issues, but also on the educational issues on how to manage a city in the middle of a crisis. One of the first things that I did, and I often say this, which is kind of interesting, I absconded my role as mayor, and I started working for the county as a volunteer. I became the liaison for the county's incident command team. Whenever there is a crisis in a community, emergency management takes over. Most of the emergency management departments fall under the county government. And I report to Mr. Dusty Nichols, who is the incident commander, who was the emergency manager for Shawnee County. And we work together with Dr. Gianfranco Pezzino and Linda Oakes, us four, working to ensure that we are communicating with the community and understanding the needs. Now, we were extremely fortunate in the fact that early on, because of the advice that I was getting from other mayors across the country, namely Mayor Eric Garcetti, who's one of my mentors, he said, "Hey, Michelle, if it feels good to close down, you're too late." And I brought that conversation to the team, and very early on, Shawnee County, before we even had a case, we did our shutdown. And that helped us start working on finding personal protective equipment for our hospitals. At that point in time, we were short N95s, we were short gowns, we were short sanitizer. It helped us develop policies on how we were going to work with different community stakeholders. We developed different community stakeholders, so much so that just yesterday I was interviewed by the Capital Journal because they were interested in the relationship that I have with the churches, and so does Dusty. And we meet with them every single week to make sure that we're all on the same page, and we haven't had any litigation between any of these groups. So there's been like an open channel of communication and advocacy for testing, advocacy for us to make sure that we have a unified community-wide message that has been extremely hard, by the way, because even though the governor and us are pretty much on the same page, we are still battling national rhetoric as well as the rhetoric of those individuals who don't think that the virus is serious enough. Now, and because of that, we were able to really drop down the cases. But as we started changing the way of operation and reopening started to happen, we're now starting to see cases increase, and we're making sure that our community has free testing, and that we have access to a lot of information and those relationships that we built early on that help us kind of mitigate the situation. At the national level, what we must ensure is that the rest of our nation has access to free testing at a mass level. In order for us to ensure that this virus is really dealt with, we need to understand who has it. But not only that, we need to ensure that we provide enough resources to different counties so that they have the public health aspect that is so important. It's one thing for you to get tested and for you to ensure that we know that you have COVID. But then the other hard part is to make sure that we walk with you to ensure that we figure out who you were in contact with and then reach out to those individuals and provide the access to care to those individuals who need to have access. On top of that, for families that have large numbers and low socioeconomic resources, we need to ensure that if they need to quarantine, they can do so without being impacted. In addition to that, our federal government needs to ensure that the resources for families that have been displaced from their jobs have the ability to continue feeding their families, and that we figure out ways to continue supporting these families as we go through this virus. So at the federal level, there's a lot of support that has to come, that we are starting to see some of it. And then the last thing that I'll add is that as we have had these packages that are supporting businesses, we must ensure that the small businesses that really need the support are the ones receiving those funds. In this first go around, we started seeing a lot of individuals receive these services that did not need them.